Good afternoon. My special greeting goes to the faculty members present, to the student and Master of Healthcare Delivery Science. For me, it's a special talk because today is the first time I give a talk after the fantastic celebration of the 20th of our rebirth in Rwanda. Remember, 20 years ago, determined young and less young men and women stopped the genocide against the Tutsi. The genocide claimed 1 million lives of our brothers, sisters, mothers, fathers, Rwandans of all age, from the wound of their mothers or old Rwandan, very wise Rwandan we lost. 20 years ago, Kigali was not a city. It was a huge cemetery with thousands and thousands of dead bodies. The health sector was destroyed. Hospitals, health centers were no longer there. Health professionals were killed or fled out of the country to avoid to be killed or because they were killers. Now we are better off. And many think that it's a miracle. It's not a miracle. It's hard work based on very serious and rigorous principles. We have focused on implementation. And many ask how the usual mathematics, the traditional way to think, doesn't apply in the development of the health sector in Rwanda. I'm going to explain some of those principles to you. First of all, I want to recall that I'm talking to you from Rwanda, in the heart of Africa. I'm not going to talk about the numbers, the GDP, etc. You have all that in front of you if you have read the article we sent to you. The first principle, we need to know where we stand. We need to know it globally, like the biggest disease, HIV, TB, maternal indicators, child death, etc. But we need also and essentially to know where we stand nationally. What are the biggest burden of disease? And if you see this slide, you can see that my next fight will be neonatology because it's the area that claims the biggest number of lives today. And if we manage to tackle that area, our life expectancy will really claim. On top of that, knowing globally, knowing nationally, you need to know the disparities inside your health sector. What are the major killers? Who are the most vulnerable vis-a-vis those killers? And you need also to know the disparity and the individual vulnerability or by people or by groups. This slide, I like it. You know who is there. It's Jim Kim, your former president. I put it there, first of all, not only because he has the green tie of Dartmouth. I want to recall he's the one who founded the institute where you are in now, but because he has stated in July 2012 this. In Rwanda, AIDS resources are contributing to the strategic investment in human capital that has helped drive the country's remarkable economic growth. For being an exception, this approach can become a rule. For becoming a rule, we need to understand what happened. First of all, we link the development of the health sector to the journey to economic growth and increase life expectancy. But the key principle behind that, we left nobody out. And that's how health increase productivity, increase economic growth, and decrease poverty at all levels of the society. And to tell you and to inform you how it's important to invest in health, I advise you to read the Lancet report, Closing the Global Health Inequity Gap Within a Generation. It's a Lancet Commission investing in health of this year. You can see that doing so, we see the life expectancy claim at the same time that the GDP per capita claim. The two are linked. You need to work to anchor the development of your sector in the economic growth of the country. The second principle, tackle health as a social issue. Health is fundamentally social. The health issue of a patient or of a group or of a society is only 10% of the problem. The rest is family structure, security, gender issue, communication, housing, clean water, nutrition, education, transportation. You need to work on those determinants of health and others at the same way as you work for increasing the clinical status of each and every client or citizen. The third principle is the way we govern. In Rwanda, we govern by cluster. Of course, we have the whole cabinet, we have the sectors, and we have the meeting we have regularly every 2 weeks with His Excellency. But every month, all the ministers that are in charge of social issues meet and discuss about the progress of each and every one, the new policies, the new strategies they want to propose for cabinet. And we together, education, health, gender, culture, youth, sports, local government, water and sanitation, we come together and we see if this new policy works in synergy with the policy we have in our subsector. And we give ideas, and immediately before this policy is adopted by the country, the synergy is created. The other cluster are the governance cluster and the economic cluster. And that's the way we have policies, strategies, action plans that are aligned with our colleagues, our other sectors. To show you an example, what drives the health sector? We have the Vision 2020 that in a huge participatory process over a year, consulting each village, we have designed in 2000. This Vision 2020 symbolizes where Rwanda wants to be in the year 2020. Out of this vision, we have national strategy to fight poverty, and also the global and national commitment Rwanda have taken, such as the Millennium Development Goals. And out of those international and national commitment and national strategy to fight poverty, we have designed our health sector strategy. You can see here, it's health sector strategy number 3, because it's the third one since the last 20 years. What is important? Using all this, we need good governance. We need accountability, leadership, and ownership. Each and every one have to own its sector. I own my health sector. I know it is part of my DNA. But it's not only for me. It's the same for the Minister of State, the Permanent Secretary, all cadres of the health sector in the ministries and in the institution have that sense of ownership of their own sector and their work. We need also to use and respect the decentralization, to bring the decision near the people. That's the only way to take in account the needs of the population. To do so, we used to apply the participatory process principle for collective actions. Participation is key. It's not only the community and the government, but it's also the development partners and the private sector. All stakeholders that have a say or an action to do in the health sector have to participate in building it, but to building it in synergy. They have to participate in the decision, in the orientation. They have to consult, even though national and are always in the drive seat. When we develop a plan, we think about sustainability. I told you that everything starts with the vision, the international commitment, the strategy to fight poverty, and the sectoral strategy. But when we apply this sectoral strategy, we need to integrate the work of each and every one. We need to integrate the funds that come for all sources, and this needs coordination of all stakeholders, national coordination. And for this, we need national leadership. The national leadership need to fight for the national priorities. And recall, I told you, the national priorities have to be those of the communities, of the population. But also, have to be evidence-based, backed up by science and research. How can we do research and have good science? It's through good partnership. The partnership you create are key in success. With the partnership, we are teaching, educating, and that's the Human Resource for Health program. Dartmouth is part of it, like 23 other universities. We are teaching together, quality teaching, improving the quality of our workforce. We are doing research together, improving the evidence we have for better planning and monitoring and evaluation. And all this bring better service delivery. This is to show where we come from and where we are today. You can see that we have 70% decline in premature death of all Rwandans, and this only over 10 years. By applying those principles in governance, in planning, in designing strategies, and also in implementation. Another specific indicator, the child mortality. Rwanda has the first ever drop in child mortality, coming from a very, very high level. We have now reached the MDGs last year. We reached it, and this slide is coming from an article Paul Farmer has written with some colleagues. It's an international independent evaluation that shows that Rwanda have the highest decline in child mortality, and while investing the less compared to other countries. We have buy more health with $1 than other countries. We have managed to do so by applying the principle I have talked just before, and the one I'm going to talk about. But before that, I want to tell you that we have invested in prevention. It's another principle of implementation. Never dissociate curative and preventive care. So more than 90% of our children are vaccinated against 10 diseases. We are very proud to have the best vaccinated children on earth. 94% of our girls aged 12 to 16 are vaccinated against HPV that causes cervical cancer. It's a strategic decision because we know that if we fight against maternal mortality, cervical cancer kills as much women on earth than around pregnancy and delivery. And you know how the world is focused on saving mothers. The world should not neglect cervical cancer for women. And also, for this slide, I would like to tell you that sometimes when the world is focused on something, don't follow the world, follow your data. If the world just say, this disease is the most important, don't follow the world, follow your data. The world invests dramatically in polio. How many people polio is killing? No focus on HPV. How many women die by cervical cancer? This slide is important to illustrate the equity principle. It shows the equity in child mortality decline. Why? It's just because the biggest gain are among the poorest. Of course, it's among where the group where the children were dying the most. But it shows that it works. It's not depending on the level of income that you have success. You have success where the people are the more poor. You have success, 5 times more success in rural area than in urban area. That means your strategy is well planned. How we reach that? By assure equity, geographic equity when you build the health sector. The health sector in Rwanda, we build it aligned to the administrative geography of the country. We have community health workers in village, health center in sector, district hospital in each district, and referral in cities. Each village have 3 community health workers, lay people that we have trained to prevent and to cure 80% of the burden of disease. Those people are elected. That's how the community participate. They chose who they trust. We educate them. Each sector, we have around 10 villages per sector, have a health center where you have nurse, A1. And each district hospital, we have around 10 sector per district, have a district hospital. Some have 2. Cities have referral. In referral hospital and district hospital, that's the place where we found doctors. In referral, that's the place we found specialists. This system have brought care near the people, where the people are living. But it's based on a drastic and controlled task shifting, where community health workers are doing the work of nurses, nurses the work of doctors, doctors the work of specialists. But doing so, we have multiplied our capacity to provide care, but we have assured the quality by rigorous supervision. Elaborate a health system is not easy. That's why I give you a very complicated slide. You have all the stakeholders on the top and down. You have the flow of money through health insurance and also through the performance-based financing. Health insurance reimburses the quantity of care, and the performance-based financing the quality of care. This motivates the health professionals or the community health workers, but it also gives a say to the beneficiary on the quality of care they have given. And it's also giving importance on the supervision and also the monitoring and evaluation. To own this extra money, you need to deserve it. So this is this slide to show that many stakeholders, you all have to align them, you have to coordinate all of them, and you have to assure balanced and equitable way to reimburse the services across the country. Innovation and use of technology are key. The health sector in Rwanda is based on e-management. We have software that are managed from the professional, the delivery of drugs, the stock, the infrastructure, equipment, etc. Cell phone at community level, community health workers report every month on activities using their phone. And starting at health center at sector level in district and cities using a computer. This means we have network coverage across the country. And we have invested during 15 years dramatically, the country, not only the health sector, the entire country, have invested in broadband and access to internet. Another principle, ensure the best for all. Poverty is not a fatality. We need to think big. This is an hospital that has been built in collaboration with Partner in Health. We were there in the design, we were there in the specification, and we give our people the best we can when we are building. And it's not because people are poor there that they deserve poor things. You need also, I have talked so far at macro level, institution and system. I'm going to talk now about issues that have counted so much in my professional life. Develop a culture of discipline and entrepreneurship. For me, I'm a businesswoman, and my output are social, and my products are the quantity of health, the quantity of wealth, and the quantity of death that I have averted. For this also, I have spent my time to develop the people I'm working with. Always develop your colleagues. At health center, central level, we have managed to educate at the level of master all the professionals that are working in the health sector. Now we are doing the same in all districts. Now you have to be tough, but before judging others, always judge yourself. Self-assessment without complacency. Point the finger to you in the mirror when those things are not going well, not to the others. Of course, sometimes you need to fire and you need to be to do what you need to do, but never judge somebody in an area you didn't judge yourself first. The next one is optimism, build on momentum, and assure sustainability. It works. Every occasion is a momentum. Even the more dramatic situation, you can turn it in opportunity. It's just a mindset. Work on your mindset and lead by discipline and example. This will help you to execute your mission. And for conclusion, I would like to tell you that where you are at work is where your feet are. This is an enterprise for some of you. It is a national health system management for some of you, but it's national. But this national is part of a bigger picture. It's part of some global history. And my national health system is part of the global health system. Think big and never lose that idea. Of course, fight corruption. I have talked about ownership, vision, and national vision, meaning serve the others. This will help you to develop your enterprise, your nation. Align the framework. Govern in a way that you are all around the same plan, with a participatory process, principle, and consensus. Don't fight on your difference. Align on where you have the same ideas. You have the vision, you share it. You may disagree on the way to reach there. It's not a problem. Agree on the minimum journey you want to take together. You reach there, you sit again, and you plan together the next step. Don't fight around your difference. Align to your consensus. This allows you to implement quickly, to implement with joy, optimism, and fast for success. Of course, evidence-based and strong monitoring and evaluation, based on human rights and community-driven. If you do that, you will succeed. And I want to recall the story of the health sector in Rwanda is a story of ownership, equity, science, participation, and sustainability. This is what I had to share with you, and I would like now that we enter in a very productive conversation. Thank you for your attention.